everyone with an interest in NASH, or more broadly, fatty liver disease, Surf's Up, Season 4, Episode 13 of Surfing the NASH Tsunami. Our preview of the second annual Innovations in NAFLD Care Congress, slated for Barcelona this May, starts now.
This week on Surfing the NASH Tsunami.
We're doing the meeting to try and fill a gap at the request of a lot of people who want to discuss fatty liver disease and liver health in a smaller multidisciplinary forum.
This is really about how we're going to take the development to the patient and empower the physicians taking care of those patients today to use it.
Every time you treat a diabetic patient, you need to think about what you're doing in the context of avoiding cancer.
We have to look after the liver beneath and make alterations, dealing with the human person. And that's what I've enjoyed about looking at how this conference is framed.
Every week, a global community of fatty liver disease stakeholders comes together to explore the most important challenges in diagnosing, treating, and developing medications for patients with fatty liver diseases. Join hepatology researcher and key opinion leader Professor Jörn Schattenberg, liver wellness advocate Louise Campbell, pricing and forecasting guru Roger Green, and their guest, public health advocate and key opinion leader Dr. Jeff Lazarus, as they preview the second annual Innovations in NAFLD Care Conference on Surfing the NASH Tsunami.
We are back. Jeff Lazarus is with us now, actually second time today with me. Hey, Jeff, how are you doing?
Fine. Thanks, Roger. Thanks for having me back, both on the podcast and again today.
And a mutual friend of ours wanted time with Jeff today and couldn't get it because I had all his time booked. So I guess for a day, I feel important. Jörn Schattenberg will be with us shortly. He was wrapping up a couple of things. And then we have Louise with us as well today. Hey, Louise, how are you?
I'm very well, thank you very much. And it's nice to see Jeff with us again. I'm always looking forward to it.
I think we should just dive into this conference. My guess is that we're going to find plenty to talk about for an hour. So why don't we just go directly to icebreaker? One good thing that's happened in the last week, personal or professional.
I'll go first. I suppose mine is we've got a new clinic opening in Marylebone High Street, which should be giving access to FibroScans twice a week at least. There, the people can book and reserve through the MyLife365.me route. So slowly but surely, we're trying to get more access to non-invasive diagnostics and more early diagnosis. As I say, slowly but steadily, and it's encouraging.
And we're still awaiting the NICE decision at the end of the month, the final NICE decision at the end of the month?
I believe so. I think end of the finance year, early April for the new finance year is usually when they would like to publish, is my understanding. As I'm currently under a confidentiality agreement, I'm not allowed to discuss what's in the document, but I do believe it's out during the beginning of April.
Jeff, one good thing for you in the past week, personal, professional.
Well, work-wise, it's that our panel of over 300 experts from over 100 countries has finished setting fatty liver disease research and action priorities, and we've prepared the first draft of the manuscript that is circulating. Personal-wise, this is no delayed flights, and I hope that holds the rest of the week. So I'm on my way to California for Liver Connect and the single-topic AASLD meetings.
Sadly, I'm not going to be able to make those. Jeff, for the last 6 months, for personal reasons, I've been unable to travel, and it actually turns out that Barcelona is going to be the first time I've gone anywhere since AASLD. Of course, if you're going to start traveling again, Barcelona is not a bad place to go to first. And so I guess my good news for the week is, well, first of all, this new setup. Everybody who's listened to this tells me I sound a lot better and clearer than I have in the past. So that'll give Magic Mike a little bit less work to do, and you guys can hear me a little bit better. It's been a good week in a number of ways, but that's the only thing I really want to talk about right now. So with that, why don't we turn to the episode? You all may remember last year, we previewed the Barcelona meeting. We covered the Barcelona meeting. We will be covering again this year. I'm going to work with the agency that's doing the meeting a little bit more closely so that we can get it to work a little better in terms of getting interviews done on time and finding a place to do them, now that I know how the whole thing works. But we're excited to see season 2. So Jeff, let's start with, we never followed up on season 1 after we did the post episode about what kind of feedback did you get, what did you learn, and how has that shaped the things you've been doing for the past year? That might be a helpful thing to do. It might also lead you into the thing that you alluded to about the 300 responses or not.
Well, thank you. And you're asking a co-chair about the feedback. If the feedback were not positive, we just wouldn't do it again. We're doing the meeting to try and fill a gap, and we're doing it really at the request of a lot of people who want to discuss fatty liver disease and liver health in a smaller forum and to discuss issues that don't always come up at the big scientific conferences, but also in a multidisciplinary forum. So, last time around we had an endocrinologist like Ken Kuzi, we had Louise, a nurse, we had, some communicators and patients. This time around it was, we want even more of all of you. We want to have it more multidisciplinary. So last time we talked about the fatal triple, and we were talking about fatty liver disease and diabetes and heart disease in one go. We want to do, and we are planning to do more of that. So I think the feedback has been really wonderful. Among other things, it was decided to keep this meeting in Barcelona, and I realized that on a scale of 0 to 1, your meeting probably starts at 50 or 60 based on that location, so I can't take all the credit, but we worked hard to put a program together that would really speak to people. So absolute state-of-the-art talks from leaders in the field from around the world, setting the baseline, setting the stage for us to be able to discuss. And I think another marker of success was people stayed in the room, right? Everybody was there discussing from when we got there in the morning to when we left in the evening.
And this year, no one is going to have to rush out midday to get their COVID test so they can get back into the States.
That was an issue, although I can say 2 people from my team have tested positive in the last week. They're not in the office, thankfully, but COVID is not over. But that's another podcast, I think.
My second bout was 3 weeks ago. Happily, it was short and mild. But if you recall, last year, you needed to have a clean COVID test within 72 hours to get back into the States. If you knew what to do in advance, you could buy a specific test that you could take online with a doctor watching. If not, you had to go get a test in Barcelona. So I was not the only American who wound up running out for part of the second day to handle that. So for those of you who can't see but can only hear, Jörn has joined us. Hi, Jörn. Welcome back. How are you today?
I'm here. Good evening. Good to see you, Roger, Louise. Apologies for tuning in a little late. Good to see you, Jeff.
Your timing is exceptional since we were just starting to talk about how the feedback from year 1 is shaping changes in year 2. Jeff gave a beginning on that, but I'd love to, as the other co-chair, get your sense of it. How is this different?
Yeah, I missed this intro, and without being repetitive, I have to share with you that I am totally excited about the second year of INCBCN. When we started this, when Jeff approached me and said, I think there's a lot of education on NASH and therapeutics, but how are we going to implement this? I was like, Jeff, I don't know. Let's start figuring it out and discuss with our colleagues. And year 1 was exceptional in terms of the feedback we got, but also, for me, the educational part. So I was very excited when we saw it was successful at a level that it will be carried forward. And I think we spent a lot of time thinking, how can we expand what we've done without being all repetitive and trying to broaden the aspect, focusing heavily on engaging key stakeholders, not only hepatologists, but, the people that are seeing patients with NAFLD today. And, moving this forward, I hope that the event will hold up to that, but I'm convinced it will.
Okay, convinced is better than hope for those who are thinking about coming. That's a good thing. With that, let me note as we do this, that if you go on the website and look at the program as it's presented, there are a bunch of holes in it. It's still a work in progress. So you may hear things about it today that aren't on the website. I don't know. I haven't checked with you or Jeff on that. And you'll need to keep an eye on it because things will be filling in as they go along. But let's start. First day, what is the goal of the day, if it has a goal of its own, and where does the meeting start, actually?
Yeah, let me make a comment about the first day because, I work at the Barcelona Institute for Global Health in Spain, and I asked Ramon Batlle, the new head of the liver clinic at the well-known Hospital Clinic, to give one of the opening talks. Because what Ramon does, and I heard him speak at the Spanish Association for the Study of the Liver just a couple days ago, is he looks more holistically. He brings prevention into the discussion, and he brings alcohol into the discussion and says we really can't talk about fatty liver disease if we're not also talking about alcohol as well and the dualness of these conditions. It's not an either or, but it's a continuum. So he's going to give one of the opening talks and set the stage. And I think it's really important for everyone to hear that. We're not working in a silo where people with fatty liver disease don't drink alcohol at all or don't drink too much alcohol, right? So he will give that talk. And one of the innovations for our Innovations in NAFLD Care meeting will be that Ken Kuzi's put together a really fantastic session with leading endocrinologists, diabetologists from across Spain who will be talking about fatty liver disease and the challenges of addressing it from a diabetes perspective. And that's in response to a lot of people wanting more of the multidisciplinariness in this conference. So we have Spanish experts from various hospitals, but who are really well known around the world and have been working with Ken. And then we move into this roundtable with Juan Mendive, who had been a part of our Wilton Park discussions. He's representing WONCA, he's representing the primary care perspective. So we're getting a day where it's not dominated by the liver health specialists, but it is a day about liver health. And we're going to set the stage with exciting lecture from Harriet Rumgay from the International Agency for Research on Cancer, IARC. And I approached her because I saw her article on the cover of the Journal of Hepatology and this amazing large-scale epidemiological, study they carried out on liver cancer. We had a mutual acquaintance, and I said, look, we should have you opening the day. I'm talking about liver cancer, because in the end of the day, people need to be reminded that a lot of the work we're doing on the day-to-day basis is to prevent outcomes like that.
That was a great summary, Jeff. If Roger, you asked what's special about day or what's the overarching theme. Again, I think as INCBCN is positioned in the field of NASH education as the meeting to have non-hepatologists and outside practitioners involved, allied health professionals, and people that are not thinking about NASH every day. We start, as Jeff said, with the fatal triple and aspects that augment the disease, and then we go to the endocrinologists to really get their view and perspective, because that's a lot of these disease or these patients with advanced disease stage R. We're going to be presenting an abstract from my group showing that elevated liver stiffness is up to 10% in patients, in the range be above 15 kilopascals. So really advanced liver disease. And a lot of endocrinologists are not aware. So this is where we want to pull them together and start the discussion. We have lectures, but really the baseline or the theme of INCBCN is that we start to discuss and develop something together. And one output of this of last year's was, of course, a publication Jeff and I led and all the members of the steering committee contributed to. So this is really something where we get to interact with our peers, even outside of hepatology.
Fantastic. Jörn and Louise, I don't remember if it was our episode last week where somebody was talking, it was Hannah last week talking about it being underappreciated the degree to which all the obesogenic cancers are related to fatty liver disease. She said, we all talk about hepatocellular, but we don't talk about all the other obesogenic related cancers. I'm not familiar with Harriet's article, Jeff, but I'm wondering if that's something that you will be touching on or not. And if there's a way to get there from here, if you want it.
Absolutely. I mean, part of the reason for her to talk about cancer was to remind us that, we're not operating in isolation, and there's a lot of risk factors for cancer. So when fatty liver disease is a risk cancer for liver cancer, it's compounded by all of the risk factors for fatty liver disease. So we really need to be starting to look at this much more holistically. So I think it's nice to have this day of alcohol and liver cancer and diabetes. Yeah, it's going to be a lot of fun in Barcelona.
Let's ask Louise, because she's doing a lot of non-invasive testing of these patients. And I think she scans patients that are increased risk of cancer. We're discussing a lot of advanced fibrosis that might not be a standalone disease, but those patients go on to develop cancer, liver cancer or colorectal cancer, breast cancer. We see more prostate cancer in males. We haven't generated all the data yet, but I know that we're looking at high risk populations. Now you can say this is, of course, the multi and comorbidity of these patients, adding genetic risks, adding lifestyle, but we have simple tests looking at liver health, and the liver unhealthy people have more events in that arena. So it can be one view that we, by looking at the liver, empowering the patients, educating them on their individual risk, we really do something in terms of cancer prevention.
I think I'm excited already to hear what Jeff was talking about and the way it's been framed around liver health. That, to me, is the key. That's one of the reasons I left mainstream healthcare to look at early detection and monitoring. And although, yes, I do see patients with liver disease and known liver disease that come and get more regular fibroscans than healthcare can provide them for their own well-being, but I actually deal with the majority of what we see as members of the public who did not know they had a risk. The whole aspect that was exciting about listening to Jeff there is if we use the premise of liver health, then looking early becomes a screening opportunity for metabolic disease. It becomes an opportunity to educate. It becomes an opportunity to locate those early cancers due to NAFLD, because NAFLD is also one of the few liver cancers where you do not need cirrhosis to get primary liver cancer. So by looking early, it changes that dynamic of purely looking for fibrosis, which is what FibroScan was initially designed to do. Our ability to now just look or discuss liver health as a way to look at prevention support of clients or people. The way we go about it is we educate people who already have a risk factor that they should be asking for liver health monitoring. So driving it to the GP, I've noticed that I'm pre-diabetic. What's my liver health? Or I've been told I've got fatty liver disease on a previous ultrasound. Can you check for my liver health? And I believe I'm also supposed to have a 2-year cardiac review. These things that get done, because that helps educate primary care physicians. And I think the one thing that's exciting, given the agenda that I've seen and or just heard Jeff and Jörn talk about, since the conference last year and the meeting, the American Heart Association have added liver health to their recommendations for people with heart disease. The American Association of Diabetes have added to their standards of care looking for NAFLD and NASH. This is a perfect meeting following both of those organizations, increasing awareness to have this meeting now with the people around that table. But yeah, the majority of what I do is look at normal people now, driving them into healthcare and making them change their lifestyle early so they don't get, hopefully, liver disease. But I'm excited by what's been said on day one already.
So let me agree with you from a slightly different perspective. I think someone on a recent episode of this podcast or the other one made the comment that endocrinologists are now treating liver cancer, because if 70% of your diabetic patients have NAFLD, and if NAFLD elevates the risk of HCC, forgetting about anything else, then in fact, every time you treat a diabetic patient, you need to think about what you're doing in the context of avoiding cancer, in addition to everything else you're talking about. And he had never thought about himself as being in cancer prevention before, overtly, but now he got it. And so I think by the way you're juxtaposing this, and then Jeff, frankly, having, as you point out, the cancer speech coming first and then the endocrinologist coming later, that's an excellent way to draw that linkage. And it's a linkage that's not drawn often enough or loudly enough. So that's great.
And just to say something in addition to day one, you started at, I think, at the program we have on the website in the program section at around noon. So as a pre-event, starting in the morning, we have something we call the NASH NIT's Real World Evidence Summit, which speaks to a more hands-on training in which biomarkers do we use, how can we implement, these aspects you mentioned, which test could be used even outside of hepatology clinics. And here the experience is aimed at people that don't do these tests every day, to get them more familiar with the type of tests we advocate to screen for fatty liver disease and advanced fibrosis.
Jörn, do you anticipate that audience will be primarily local, or that there will be guests coming into the meeting from other locations that also need that kind of training and support?
We specifically reached out to get endocrinologists involved and colleagues from diabetes practices to participate, and we're continuing to invite them because I think it'll be a great experience. We're going to have some hands-on training and some lectures also as a discussion and question and answer opportunities. So it will be locals, but there is some people traveling and participating for that.
So Louise, Jeff, any other comments on the first couple of sessions? I guess it starts at 2 in the afternoon. On the academic portion starts at 2 in the afternoon. The sessions that you talked about, Jeff, take us to about 5. And then there's something without much information in it right now called a patient organization session. So I'm kind of wondering what that's. You did mention Juan Mendive, who will be one of the roundtable discussants, but what are you envisioning the session to be?
So we wanted to talk about integrated care and the role, a little bit like we were talking about earlier today, Roger, that primary care is going to play in terms of addressing fatty liver disease, and not seeing this as one more thing, but seeing this as a facilitator to addressing so many other issues around non-communicable diseases, from diabetes to obesity. So we have Juan from WONCA representing primary care there, a few patient representatives who are going to discuss, where do you want to go? Do you want to go to your primary care doctor? Do you want to go to your specialist? And the jury's out. In other conditions, happens. People with HIV often do want to go to a specialist. In some settings, people prefer to go to their community doctor. It can be a cost issue. It can be a convenience issue. It can be a familiarity issue. So we're going to close the day with that kind of roundtable discussion.
Great. So for those who don't know, because a lot of Americans will not, WONCA is an obesity organization, yeah?
The World Organization of Family Doctors. So this is the primary care organization. And Juan Mendive was asked to represent their European regional section on these fatty liver disease experts. It's a total coincidence that he happens to be from Barcelona. So when we wrote to WONCA and asked them to send someone to Wilton Park, it eventually ended up being Juan. And then I said, well, you're already in Barcelona. You got to come to the Barcelona meeting too. So that's how it happens.
And it nicely complements, the first session where we have the diabetes physicians. So it's a full spectrum of physicians.
Okay. Any other questions or comments about day one, or shall we move on to day two?
I've got one comment about day one in relation to, I was having a health conversation in Australia earlier on this week, and the cancer one does interest me because the fourth leading cause of cancers, deaths in women in Australia is pancreatic cancer. It is now above liver cancer. And we know that obviously NAFLD and pancreatic cancer are linked, but I've always really seen pancreatic cancer as a rare cancer, but it is screaming up the mortality rates. And I'm really interested in that session to see whether we link, because both pancreatic and liver cancer are some of the top cancer deaths for men in Australia as well. So I'm really interested to try and get into her session on that. And we don't really talk about pancreatic cancer in its linkage, but I was shocked to see how rapidly it is rising as a major cause of death for cancers in both men and women.
So with that, we'll just move on to day two. And Jeff has provided a link that we will share with you folks. I guess that's for WONCA, right? Global Family Doctor. So will one of you please take us into day two?
I'll be happy to start. And if you could supplement Jörn. When we start Saturday morning, not too early, but 9 o'clock, and we'll be looking at overcoming the challenges of diagnostics. So Dr. Mauro Ranella, who's so well known and led the ASLD guidelines, will chair. Dr. Lena Allen from the Mayo Clinic will look at automation and artificial intelligence, MLA, some really interesting work she's doing. And Mazen Noureddin will look at bridging the gap between science and current care pathways. We'll have some abstracts, and then we'll move into an industry session, something we did last year as well, a chance to engage with industry. This is incredibly important. Everyone at the table here to discuss and move the field forward. So we'll have industry representatives, both from Madrigal, from NASH, from EchoSense, discussing, and then we'll go into treatment and care issues. Jörn will speak more to that, but what I'm also very excited about will be the debate on, is being vegetarian a cure for NAFLD? So Dr. Shira Zawarsagi from Israel and Dr. Camilla Dabu Hansen from here in Denmark are going to go for and against the proposition. They're both really well known in the field for their positions on meat consumption, diet, lifestyle interventions, and we'll have some discussion on what's it going to take in terms of what you eat to reduce the amount of fat in your liver. And then we'll have some discussions on behavioral interventions. Stephen Harrison will give his always amazing state-of-the-art talk on medical therapy. And then we'll move into, both Stephen and I, looking at health equity in fatty liver disease. And as you know, addressing disparities, which the Americans call it, and equity in Europe is such an important issue to me. How do we make sure that everyone who needs access to treatment and care, the system, is able to get it? So we have Dr. Zubair Younasi, who will also be discussing from payer perspectives, and my former postdoc, Dr. Juanma Pericas, looking at socioeconomic status in fatty liver disease. He led a really nice public health corner in the Journal of Hepatology recently and has been reviewing all of the literature around the world on socioeconomic status inequities and fatty liver disease. And then we'll move to Dr. Precisa Carrieri, based in Marseille, Italian, who will look at NAFLD in women, risks and interventions, before Jörn and I move into wrapping up Saturday.
So first of all, Jeff, we're all hoping that there will be a major reveal as you and Jörn wrap up Saturday, because you have to live up to your reputation from last year.
Oh, don't worry about that, Roger. I hope Jörn is shaking over there, because I've been working on this literally since 20 minutes after the last one.
I'm stunned to hear that, Jeff. It's so unlike you. If you follow the podcast, then you know that in the interim, Mazen has dubbed Jörn Matt Damon. So you have lots of room to play here, my friend, and lots of direction directions to go in as far as that goes.
Just tell me it's not gold lame shorts with NASH printed across the rear end.
It is not, but I can tell you, even Mazen has the fear. You can ask Mazen the next time you speak to him what happened to his nice shoes at Wilton Park when we went up to see the sunrise. He didn't come down with them, let's put it that way.
I had a bit of a giggle when I looked at the programme on the can vegetarianism be the cure for NAFLD? Because if I had £1 for every vegetarian I've scanned with fatty liver disease, I would be probably better well off now by charging for that than and it's like, I can't possibly have fatty liver disease, I'm vegetarian and vegans, so that's going to entertain me. I'm looking forward to that one.
Let's take bets and see how the debate is going to be won.
When Louise raised this with me, I guess this morning, my comment was that I know a lot of people who I would describe as pastatarians. That's to say they're vegetarians, but they eat so much processed flour in different formats that they would do a lot better eating meat. So my guess is part of it might actually be not just do you eat meat or not, but what do you eat?
I think you're getting ahead of yourself, and that's what the debate's going to be about. So there'll be a lot of opinions in the room. You are what you eat.
Yeah, or what eats you. It depends upon exactly what kind of mood you're in on a given day. But yes, I like that. So one question. I mean, you've mentioned patient organizations, Jeff, but where those folks are going to show up in this program or the role of nursing, where will you be filling in blanks with folks who are non-physicians, or where are there slots that they might come into the conversation?
Yeah, so, well, I mean, some of that debate, Dr. Shiraz Obersagi is a clinical dietitian, and Harriet Rumgay, is an epidemiologist. And then we have the roundtable that will bring in patients. So, it's a small meeting with a limited program, but we definitely want all of those fields and patient groups represented as well. And patient groups, not just from the liver field. So we have reached out to the World Obesity Federation and diabetes organizations. And that's also where the meeting will be heading. So if we're a little more on endocrinology this year, we may grow that depending on the feedback, or we may then decide we want to grow with the nursing aspect.
Just to comment on that, I think, yes, I was on a panel last year and nursing and that area and the strength of that interaction to patients was brought up several times by primary care physicians. One of the things that I get from listening to you both here now is this bringing in of multi-comorbidity fields. Now, I would hope that those thought leaders in those fields are going to take back to their nursing colleagues and other allied health as to how we can foster a strength, because although we talk about hepatology nurses, there is no skill set in hepatology nurses for NAFLD. We had to build it within hepatitis C. We in hepatology see patients at end-stage disease when they're diagnosed. We're not at the forefront. You did a beautiful piece a few years ago back on the equity in the fact that nobody coming into hospital really gets access to healthcare professionals that know about liver disease. So they're stigmatized from the minute they come into a hospital. We don't have that skill set within a hepatology nursing area that I'm aware of. We don't really have it in cardiology and diabetes nursing, but it's a strength we can develop quite quickly because we talk about a lot of the common areas. The program as it's been designed to me offers that ability for people to take back, share with their nursing colleagues, look at small projects that can do that, and we can upskill very quickly because we will have the first medications out in the next 14 months, we presume, with resmetirom. So I think there's some strengths within that to be able to be shared with allied health, even if they're not buried in that program as yet. Would that be right?
Yeah, I think we have room for some involvement in the discussion around the primary cares and general physicians, as you said, to include nursing as their central, the first patient they talk to in a general practitioner's practice is not the physician, but the nurse. And I think that was one of the take-homes of last year's workshop we had. While this could be the primary contact, it's again, maybe not where the primary attention is with nurses, as I understand you at this time. And for sure, there's something we want to develop. By putting the program up it is now, you can see that we've shifted a little bit to have the physicians sensitized to them, because I think through the physicians we'll also reach the nursing teams to some extent.
That's the strength of the program that you've put together. I think that was exactly my comment, is that I think they can take back, see potential opportunities to work with and strengthen their nursing field. And that for me is exciting about the way the program's been developed.
Interesting. So I guess what I'm wondering as I'm looking at the second, first of all, I think you're on your comment about having an amazing faculty faculty throughout the meetings, I think, correct. But day 2, this is everybody's fantastic and fantastic on topics. I will be really interested to see what Alina has to say about automation and AI, given that at Mayo they're doing work and that she's publishing that looks past even traditional liver tests at all kinds of other measures. Obviously, we did an episode here a couple of months ago with Predictive Health Intelligence, Tim Jobson from the UK. Similar kind of thing. I do believe it will be interesting to see what she has to say and how quickly we can start to amp up diagnosis by either giving people simpler ways to do this or giving systems similar ways to gauge it. So I think that'll be fascinating. And I think that, Zobair is obviously a fantastic choice to talk about payers. What do you see happening in the discussions second day, besides the general people will converge? Any specific areas where you think things will pop up or might pop up?
I find it hard to anticipate the discussion other than say that it's going to be a very informed discussion, but also from a multidisciplinary perspective. So I would expect it to be a bit disruptive at times and asking questions maybe less related to the methodology and more about to why are you doing this at all? How does it really work? If it's as effective as you say, how can we transfer this to other settings? So I think every talk that we've lined up is going to generate a lot of discussion. That was the hallmark of the meeting last year where you were in attendance. There was a lot of discussion. We're trying to have shorter talks, but to really lay the groundwork for these discussions. And it's a chance for people who don't know as much about our field or each other's fields, but we're all related to liver health. I'm sorry, if you're an endocrinologist and you're not dealing with the liver, it's just because you're not, doing all of your job. And if you're working as a hepatologist and you're not talking about diabetes ever, you're also not doing all of your job. So it's a chance to have everyone in the room in a let's say, a friendly, supportive environment, sharing their experiences and looking at how we can push the field forward. So the talks are driven by scientific excellence, but it's not to, hammer someone on their methodology. We've invited people who have proven again and again that they're leaders in the field. So now we want to hear what they think we need to know to inform that discussion.
So in the what, now what, so what design that people talk about for presentations, Jeff, do you envision the roundtables being the so what or the now what or both?
I think it's more of a now what. I think the so what was put to rest in those major keynote discussions where we're fed and we're presented the excellence on a particular topic. That's the so what. This is what's in the pipeline. This is what's working. This is what's not working. And then a roundtable says, well, now what? We were told we need to improve risk stratification. We were told that certain aspects of AI can facilitate our work. Now what?
Okay, good. I love that. And I agree. I think last year was extremely strong on now what. Actually, about as strong a meeting as I've ever seen on that subject. So I thought that was great. Jörn, you look like you have something to add, but I'm not sure.
I agree with Jeff. If this was a mainstream liver NASH meeting, it would be all about drugs, MOAs, and a basic science lecture on how new drugs are going to be developed. But this is really about how we're going to take the development that has been made and bring it to the patient and empower the physicians taking care of those patients today to use it. There is a talk on behavioral interventions. Ono Hollebom is an endocrinologist dealing with type 2 diabetes every day. And what can we learn from that group of physicians to, we as hepatologists change the behavior of our patients. A lot of times in the discussions we throw up our hands and say, lifestyle's not working anyways. Let's just move on to the talk given by Stephen Harrison and hear what the drug arena is going to look like. But this is not how this is going to work here. I think we really want to learn from each other and, not hepatology telling everybody what we think has to be done, but really also being educated on, what endocrinologists have been good at managing comorbidities in patients living with type 2 diabetes and the increasing evidence there is generated on the role of type 2 diabetes and the risk for liver disease in these patients. A lot of physicians have not considered that. We're talking about it every day, but I think this is something we want to put out there and discuss together. I think I said that once or twice now on this podcast from a different perspective, but that's really what it's all about.
So now it's November of 2023. What will tell you whether this meeting has worked out in the 6 months following? It's worked as you hope. What would we see that would tell us that?
There's always a couple of KPIs. After last meeting, we didn't stop. So a number of us worked together to publish an article about it, highlighting key aspects of the meeting that we published in Nature's new open access journal, Communications Medicine. And that recently came out. So that was probably November 2022. November 2023, we have speakers who have asked if they can come back. We have an organizing committee that said, let's do this again. And we have all of the funders lined up. If someone said you have enough funding to have 300 or 400 people, I'd say, okay, but I probably don't want more than 150 people in the room and everyone else can come in online. There's a purpose to this meeting, as Jörn mentioned as well. I mean, everybody's kind of in the room. So last year when we were well over 100 people, that included the people online as well. If it gets too big, it becomes a different kind of meeting. We're not looking to compete really with any of the existing meetings. We're filling a gap and looking to have really informed conversations. I'd like to see feedback on which aspects we want to grow. Like you were saying, Louise and Roger, different kinds of patient groups involved, nurses and others more front and center. Do we grow endocrinology? We'll do whatever really the feedback tells us to do. We'll do the best we can based on that feedback. But I'd like to see a November that said funding was in place. There's a lot of excitement for this to happen again in 2024 in Barcelona.
Okay, that's a great start. If people are supportive, then that says you've done something worthwhile. Absolutely. So the one question I have, Jeff, when I think about a meeting this small is, in how many ways can the insight gathered there make its way out into the broader population?
Well, again, by having leaders in the field, the idea is that they bring it back. So by having heads of organizations, heads of large hospitals, we wrote it up for a journal. There were a couple interviews held. You're helping in a huge way bring this to a larger audience. So, conferences work in different ways, and most are more traditional scientific conferences. We're speaking to our peers and we're changing practice. So here we have, representative of WONCA, or representatives from obesity and diabetes in addition to liver, and hopefully it will trickle out because we're actually holding the meeting because we want to make a change, not because we need another abstract accepted and added to our CV or an invited talk. This is people who are committed to advancing the field in a different way than the metrics many of us are used to. Well, most of the people speaking don't need to abide by those metrics anymore. They're above, they're tenured, and they're well published. But for many people, and most people, we have certain metrics that are really about publication. And this is really about top line presentations coupled with exciting, engaged discussions.
I love the meeting, and I think it will be fascinating to see the ways that evolve to get the integrated thinking in the meeting into a world that has lots of ways to handle siloed thinking and fewer ways to handle integrated thinking. So that was really what was behind my question. And I take your answer, which is probably more organically than anything else. We are heading towards the top of the hour, which means we're heading towards done. That was not my closing question. My closing question was, if you had a guess, how do you envision the agenda might impact the next 12 months? And what would you see maybe might be a bigger focus in 2024? And I know that we're guessing, and I'm not going to hold anybody to it, but it's always a fun question. Brave one, go first.
Let me start here. I do see that the discussions we're having is going to shape the field. We're going to design our research questions and asking how can we interact with the other experts, primary care, secondary care, in identifying those patients at risk. I think the discussions we're having here will form, from my scientific and academically orientated work, the basis on which research study do I need to set up, or which project do I have to develop to really increase the access of patients with or at-risk liver disease to be diagnosed and potentially have access to care. I think this is one thing for me personally. I think in addition for the attendees, clearly we will come up with ideas on how to implement therapies and novel diagnostics that will become available. And I think some of the ideas we bring forward will in the end make it to the field. As such, I do see us as a think tank that will develop the care provision of patients with non-alcoholic fatty liver disease.
Thanks, Jörn. That all makes tremendous sense and pretty good aspiration at the same time. Jeff?
I see over the next year a continuation of the important issue of developing models of care that are fit for purpose. When we started a few years ago and reviewed the literature, we came up with 8 published models of care that fulfilled the criteria of the who, what, where, when, and to some extent how a model of care can be multidisciplinary, can help be people-centered, that can be effective. And this kind of meeting is bringing together the different players in this kind of model of care. So diabetes, primary care, various patient groups, hepatologists, of course, nurses. And how do we advance the field around the all-important issue of getting people diagnosed, getting them risk stratified, getting them the treatment and care they need? One thing I'd like to look at further ahead, and this is going to be part of this debate, chicken or the egg, treatment as prevention, but also prevention as prevention, right? Because the numbers are so big, and the latest prevalence meta-analysis that Dr. Younossi just published in hepatology with the team shows that it continues to grow. Over a third of the adult population estimated to have, non-alcoholic fatty liver disease. So we need to be thinking really big, and hepatology is not going to be able to do this alone. So for me, it's really about the whole of society approach, the whole of health system approach to addressing this, as you would call it, tsunami.
Yeah, I agree with both Jeff and Jörn on that. The way I've seen this conference framed, it's about liver health. It's not about only hepatology dealing with liver disease. And I think that removes the competitive nature of silo healthcare. I'm a cardiologist, I'm an endocrinologist. That if we all drive like we do to try and locate people with cancer, if we drive to locate people with poor liver health, and I know I say it a lot, but rule it out, don't wait to rule it in. It's a better scenario. The way this conference is framed for this year is about removing those barriers and letting us all think liver healthy. And for that for me is the way I see it going. We all have a liver. We just assess people, and the ideas that will be taken through there, particularly if yes, people drink alcohol, but people eat crisps, people have bad habits. We can't individually rule them out. We have to look after the liver beneath and make alterations, dealing with the human person. And that's what I've enjoyed about looking at how this conference is framed now and going in that direction. So I can see both Jörn's outcomes and Jeff's envisaged in this type of framework.
I agree with all that. And the thought I'm having as I'm listening to this wrap up is that what will happen in the next year is we will probably get drugs. And it will be interesting to see how approvals, even if only in the U.S. in the next 12 months, shape all the questions you're dealing with here. It's always been hypothesized that primary care will become much more interested once there are medications. Endocrinology will become much more, even hepatology, but certainly the frontline treaters. So it will be interesting to see how this amazing work that you guys are doing and the fantastic vision behind it play out in terms of not making this just about, okay, now we've got drugs, now we can prescribe something, we're done. But to envisage the holistic nature of the problem and to see drugs as an amplifier and, if you will, a booster rocket, but not the end point of the venture, or even maybe the end of the beginning, but not the reward in itself, if that's clear. So with that, we are now 1 hour in and we're at 3:01. So let me thank everybody. Jeff, thank you so much for being with us here, and thank you twice for being with twice today. Jörn, Louise, thank you very much, everybody. Great podcast. And we will be back next week, I believe, doing a preview of International NASH Day. It's a big preview time for us right now. I'll be back with a business report in a few minutes, and everybody else, bye-bye now.
Bye.
Thank you. Bye.
And now for the Season 4, Episode 13 Business Report.
Slava Ukraini, Heroyam Slava, glory to Ukraine, glory to heroes. The new news this week in Ukraine was that Vladimir Putin, newly indicted for war crimes, paid a visit to Crimea and then occupied Mariupol. Here in the U.S., Governor DeSantis' statement demonstrating lack of support for the Ukraine was disappointing and conveyed a lack of knowledge of the history and reality of the situation. It was gratifying to see Republican senators disagree publicly with what are now the two leading candidates for their presidential nomination. Let's hope sanity pervades. Slava Ukraini.
Get ready for our third birthday party.
NASH Tsunami will celebrate its third birthday on the April 17th episode. If you're a listener subscriber, keep an eye out for an invitation to attend live. If you're a past sponsor or corporate ally, expect a call from me sometime this week.
Our download counts are staying extremely strong.
Last week, I told you the first 13 days of March came in around 350 downloads per day. 1 week later, we're maintaining that 350 download a day average. Just a reminder, our strongest month ever has been 327, and that was February.
This is officially our first quarter over 25,000 downloads.
We crossed the 25,000 download threshold for the first quarter late on Sunday evening, March 19th. The next challenge is to finish March strong enough for it to be our first ever 10,000 download month. We need to average about 265 downloads per day for the rest of the month to make it. I like our chances, although, as Yogi Berra said, it ain't over till it's over.
Today's Vault episode looks back to the inaugural INCBCN conference.
Today's Vault is the final conversation for last year's INCBCN wrap-up conversation. You can hear the many ways that this year's conference reflects some of last year's findings and discussion. And with that, I'm off for another week. Thanks to Jake, Magic Mike, Steve, Eric, and the well-oiled marketing crew for helping get this episode out the door and promote it. Next week, we're considering 2 different concepts you'll have to listen to hear where we land. But until then, make sure to let us know how you feel about Rising Tide. Don't forget to send reviews about NASH Tsunami. Stay safe, surf on. We'll see you next week on the podcast. Bye-bye now.
Have any questions for the surfers? You can send them to surfingnash.com, and we will answer on the podcast or the website.